Okay, so this is the audio lecture for chapter 6 and 7. Chapter 6 deals with information technology in radiology. And in chapter 7, we're going to talk a little bit about information technology in surgery. So what you can expect from these chapters will be a briefing of what I will be giving in these particular lecture notes. My PowerPoint notes, as always, they just serve as a guide to kind of let you know what to expect from each chapter. The material that's being covered, kind of give you just a general overview or a general briefing. I don't go into a whole lot of details in the notes. That is because the expectation is for you to be able to read the chapter in order to better understand the concepts. I can't take everything from the chapter and plug them into the notes. It'll make them too busy. PowerPoint notes are designed just to give you the most highlighted information or the most important concepts. Again, going into the book and reading the chapter goes into a little bit more detail, and it's a lot more in depth. So with that being said, this lecture won't be very, very extensive, but I will highlight what you can expect from the reading of the chapters. So when we talk about information technology and radiology, I think it would be more appropriate to start by talking about what an X-ray is and how and why it's used in the medical field. So I'll just give you a general example. Let's say that you are playing sports or you're out in the garden working, you slip and fall and your ankle is in pain. Okay, so you decide that I'm going on to the doctor and see about my ankle. Normally when you go in and present with this type of condition, the first thing that comes to a physician's mind is, let's do an X-ray. And basically when he says, let's do an X-ray, what he wants to do is take a digital image of the part of the body that is affected by the injury, and that gives him a general idea, because what he's looking for swelling, he's looking for misplacement of bones, he's looking for any fractures, any broken pieces. Those things will help him by way of an X-ray, the imaging techniques that will help him to determine what his next step needs to be. If it's something that's broken, that helps him to decide, okay, I need to put a cast on it in order to start the healing process. If it's something that's just swollen or something that's just a little inflamed, then I can give an antibiotic for that. In order for him to make a definite diagnosis and to get him started with how he needs to treat you as a patient by way of an X-ray, he has to do what we call digital imaging. And that's what X-rays are about. Now, in chapter 6, it talks about several different types of imaging techniques or several different types of imaging machines that can be used in the medical field. And we're going to talk about each one of those very briefly. So the whole purpose of this chapter is basically just to kind of give you an overview, just a general overview of the impact that information technology has in the field of radiology. And of course, again, I'll mention again, radiology is the branch of medicine that uses imaging techniques to diagnose, and it uses radio waves to treat disease. So radiology, the branch of medicine that uses imaging techniques to diagnose and radio waves to treat diseases. So a digital image is an image in the form of a computer. It can do several things. It can process information. It can store. It can make pictures. It can even look at very complex issues beyond just the norm. And then, like I said, there are several different types of pieces of computer technology that is used in radiology. And I'll just kind of mention them and talk very briefly about them in a few moments. Things like CT scan. If you've never heard of that, you'll hear that language as you get into your job. You'll hear these different this different type of language. So you know CT scans. You may hear people say MRIs. You may hear people say specs. You may hear people say PET scans. All of these are just some examples of the different type of radiological techniques that are used in the medical field. Okay. Traditional X-rays use electromagnetic waves to produce image on film. So basically, you lay on this table. You have this machine that comes over you. You have different type of boards they may put under your feet, under your ankle, wherever they're going to take the actual picture. Usually, what they do is try to make like a plus sign on the body, that body piece that they're going to X-ray. And basically, they have a centralized point that they need to get to, a very specific area that they're looking at. And you lay still, they'll tell you to lay still, or if it's a chest X-ray, they will tell you hold your breath, or inhale, exhale. And basically, it's just a push of a button, and the radiation from the machine radiates onto whatever that organ is, and a film or an image is produced. Those films have to be processed, or they go through a little processing mechanism, and they're used for just so many different things. I may mention before, imaging broken bones. You do some sort of X-ray when ladies have mammograms. Now, one thing that X-ray cannot do, it cannot image any kind of soft tissue. That usually have to be something a little bit more specialized. I put a picture in here, figure 6.1, of just what X-ray of just a normal chest X-ray would look like. So when you look at that picture, you can actually see the left and right, those bones on the left and right, that's actually the rib. So those like the rib cage. In the middle is the sternum, okay? The two little wings at the top on the left and the right, that's pretty much part, those like your shoulder bones or whatever. So you can kind of see, you can kind of get a visual of what a full chest X-ray look like by way of just the picture I gave you right here. And it's just a traditional X-ray. Oftentimes, individuals may have to have ultrasounds done. The one key thing to remember about ultrasound is that it does not use any type of radiation whatsoever. Yes, it can produce images, and it uses sound waves and echoes as a way to produce images and pictures. It produces moving images, and again, there's no radiation involved anytime you're doing ultrasounds. Ultrasounds are used for several different things. One of the things that it's used for is to help develop or to help diagnose anything that's going on with the fetus. So, a lot of times ladies that have, pregnant women that have amniocentesis done, or if the doctor just want to look at the baby. So you know how like when you go and you want to find out what the gender is, or if you go and you want to, and he needs to listen to the baby's heart rate, or he needs to look and see where the baby is, he'll usually order an ultrasound. Ultrasound can be used in detecting prostate disease in men. It can also be used for gallstones, to detect gallstones in both males and females. It also is good in diagnosing cancer in pregnant women. I put you a picture in here, figure 6.2. This is an ultrasound image of a fetus that's only 4 months old. 4 months old. You can actually see the head. You should be able to see the nose, the mouth. Can't really see the ears, but they're there on the side. You can kind of see the little stomach portion of it. And it's a pretty good image. But that right there is just an example of an actual ultrasound. Ultrasounds uses what we call three-dimensional endoscopes. That's usually used like doing minimally invasive surgery, so something that needs to be very, very minute. Basically, the way it works when it comes to monitoring a fetal heart rate, there's like a little real tiny device. It's probably about the size of a silver dollar. That's what's actually used when they're rubbing the stomach and they're going from left to right and up and down, and that's all it's about the size of, and just that little minute size of a device is able to actually track and monitor a fetal rate beat. Now you have CT scans. CT scans uses X-rays and digital technology, and what it does, it uses it to produce a cross-sectional image of the body. CT scans are used for soft tissue. Remember, regular traditional X-rays cannot X-ray soft tissue, but a CT scan can. It does have the capability of being able to X-ray soft tissue. A CT scan is more accurate and it gives a more detailed image as to what needs to happen, especially if it's a patient and the doctor's trying to decide if he needs to do surgery. He usually will order a CT scan because it will give him a much better, help him to make a much better decision as to, yeah, I really need to go ahead and do surgery based on the results that I'm getting back. Some other diagnoses or some other things that CT scans can be used for would be diagnosing what we call severe acute respiratory syndrome. It has been used for X-ray and things dealing with the bladder. Like if a person is having something going on with their kidneys. It has been known to diagnose things dealing with the heart, such as if the doctor suspects there may be blockage. He can order a CT scan and take a look at the arteries within the heart to see if he can see any of the blockage that's there. And again, a traditional X-ray wouldn't pick those kind of things up. MRIs, known as the magnetic resonance imaging. It also uses magnetic fields, but it uses very, very strong magnetic fields and radio waves, and it's used to produce pictures as well. Now, I put a picture in here, figure 6.4, just to give you a visual of what an actual MRI machine looks like. The next slide behind that just tells you some of the things that it's used for. It too can image soft tissue. MRI can take images of the brain. It has been known to find a whole lot of brain abnormalities. It can detect abnormal tissue as well. And also women who are at risk for breast cancer normally benefit really well from having an MRI of the breast along with mammograms, and these are the ones that are, at the much higher risk for having breast cancer. You have what you call functional MRIs. Now, functional MRIs are used for conditions such as, like, say, for instance, if you want to look at brain images of a patient that may be possibly schizophrenic, or you need to look at some areas that were affected by stroke or by a brain tumor. Having a functional MRI serves the purpose of that, because what it does, it measures small metabolic changes in brain activity. Okay, functional MRIs can be used to identify brain areas by function in the operating room. It can help assist the surgeon in avoiding damaging areas such as those associated with speech, strokes. Brain tumors or injuries can also affect the areas of the brain where functions such as speech, sensation, and memory occur. So the functional MRI basically gets down off into the brain, and those areas such as your speech, your movement, those things that affect the brain, is able to produce an image and help the doctor with making sure he doesn't do any damage to those areas and things of the nature. And these are things that kind of happen during surgery. Now you have what you call PET scans. PET scans also is used or can be used to create images of the brain or the body in motion. Basically, it's used to help doctors diagnose mental disorders in patients, speech abnormalities, patients that have Alzheimer's, maybe someone that's having trouble with their thinking or their cognitive skills with their thinking. They can't remember things, they're forgetting a lot of things. Maybe someone that's bipolar, and then of course cancer. I put your picture in here, figure 6.6. It's just a figure of the human brain itself. Okay. PET scans can be used for the accuracy of breast cancer in both basically male and female. Most of the time, female. You have SPECT scans. SPECT scans are used for a variety of things, studying blood flows, if there's some stress fractures going on, different type of infections, certain types of tumors. It also has been known to be useful in images, like taking images of the heart, and also in doing some bone scans. Okay. Then we have our bone density scans, and of course, it is just what it says. It's a pretty much a type of X-ray technique that is basically used to help diagnose osteoporosis. And you know, osteoporosis is the breaking down or the destruction of bone, and it's used for that reason. Osteoporosis increases the risk of hip and spine fractures. And what happens is bone loss is normally normally takes place because of aging. And so one of the things that doctors would do, because it is a weakening of the bone, anytime you hear osteoporosis, it's a weakening of the bone. So in the areas where the doctor may feel that the patient is losing density in their bones, he'll usually order a bone density scan to see how much bone loss is really have really accumulated. Now, some other imaging techniques that are mentioned in your book, one of them is called LUMA. LUMA is a cervical imaging system, and it's used to detect cervical cancer. Usually when this particular technique is taking place, it's usually used in conjunction with what they call a colposcopy. And that's a view of the actual cervix in women. A colposcopy magnifies the cervix of women who have abnormal Pap tests. So basically, the LUMA light is like a light that shines on the actual cervix, and it's there while the doctor is in there maneuvering around and trying to find out what the issue is. So it has to, and what it does, it creates a color code map for the doctor, and it helps him to pretty much pinpoint different areas that he may need to do a biopsy on. And this usually happens from individuals that have what we call abnormal Pap smears. Innova is also another imaging system, and it's used for imaging vessels within the cardiovascular system, because a lot of times you have real tiny vessels in the cardiovascular system, and the Innova is designed to be able to image these vessels because they are so small. So you may not hear a lot about these different type of imaging techniques, but the book does mention them as a part of an X-ray technique that is used. PACS picture archiving and communication system. So basically, PACS is the server. It's the actual individualized technology piece that is used to help produce the images from X-rays. Okay, PACS is the actual server, just like any other server that you have. You know how you have Metasoft. You know, when you use Metasoft for administrative practices, and you know how you could see the patient's chart and input information, and it saved it and done this and that. That's what PACS is considered. PACS is the actual server for any kind of communication. So it transmits, it stores, it retrieves, it displays digital images. It does all of that, and all of that's done over a course of a network. Okay, so it combines with other computer systems in order for doctors to pull up and read and do whatever they need to do in order to make a diagnosis on patients. And then the book just kind of goes on and mention interventional radiology. And it just talks about some of the different types of ways that radiology is used in the medical facility as it applies to information technology. So basically, the effects of digital technology, of course, can be overestimated. But as images become more precise, surgeons are being able to do better guidance when they're doing surgeries and different things. So when it comes to interventional radiology, it's just basically finding ways. Basically, where we're getting to is this. Surgeries are starting to become minimally invasive. So a lot of doctors are trying to get away from just, cut. It's almost like make a little small incision, stick something really thin up in there, and do what you need to do. You're getting more doctors are getting more into laser surgeries. Some of the benefits of having laser surgeries, you don't have as much recovery. You don't have to take as much recovery time. And as we get more into interventional radiology, it's going to get to a point where it makes finding things, x-raying things, diagnosing things, it just makes it a little bit better. Now, a lot of times when you look at a lot of interventional radiology, you have to keep in mind that, sometimes those type of techniques may require more radiation. And that's because, if they're having to use such a more extensive technique, radiological technique, usually like the more intense or the more high-tech the technique may be, the more radiation may have to be used in order for them to produce great images. So that's kind of what the last little few slides kind of talk about. There's a little bit of information mentioned about, medical radiation. Being careful that you're not being exposed to too much, because you think about cancer patients when they have to go through chemotherapy and radiation. They're being exposed to a lot. So that's why a lot of times they don't feel the best. They tend to become really fatigued really easy and stuff like that. It makes them tired. But still you have to be careful with. You have to be careful when you always want to go and have an x-ray done. Just always remember, anytime you go and have an x-ray done, you're exposing yourself to, to radiation. So you always want to make sure that you don't receive no more radiation than what you should be receiving. Okay? So that pretty much sums up chapter 6. It's not a really long chapter. And pretty much they're just kind of straight to the point. Basically what they do is they just kind of wanted you to be familiar with some of the pieces of information technology pieces that are out there as it applies to the X-ray department. So when we get in chapter 7, technology in surgery. So I'm sure if you were to go and have surgery, you do not want a robot working on you. I'm just so sure of that. But there is something called computer-assisted surgery. And basically it involves the use of a virtual environment technology to provide surgeons with realistic, accurate models on which to teach surgery and to plan and practice operations. So with surgery, it is one of those things that is very wide open. It is growing, and there's so much stuff out there that doctors can use to help them while they're doing surgery techniques. Surgery in today's society, the way surgery is done is so different from what it was years ago. Years ago, you didn't have as much technique as you have now. You didn't have as much laser surgery as you have now. But what doctors are finding out is the more they open themselves up to becoming abreast to the different types of technology techniques or different types of technologically machinery that can help them doing surgery, the more that becomes widespread, the more doctors are more open to that. It just makes performing surgery techniques so much easier, a lot better. So what chapter 7 does is just talk about some of those different things that takes place. For example, MIS, minimally invasive surgery. That's basically the use of doing surgery using an endoscope. And usually, MIS is conducted by using small incisions. Usually there's a lot less pain, and again, there's shorter recovery time. Versus if you make it a big slash, deep cut, you know that's gonna be painful, lots of recovery time. But more and more doctors are getting into the MIS, where it doesn't become, whatever makes it easier for the patient, so they won't have as much pain. You may see that done in heart surgeries, people that goes and have the stomach reductions, the breast reductions. MIS is used in a lot of variety of different places. Figure 7.2 is an example of a minimally invasive surgery instrument. Robots. The book goes on and talk about the different types of robots that are used. And again, in this class, basically what you do, you just get introduced to different types of technology pieces out there. Why? Because depending on where you're going to be working, what facility you're going to be working at, you just want to have like a general idea, especially if you're going to be working in a hospital. Let's say, for instance, you decide you want to do administration in a hospital. You just want to make sure that when you get asked any questions about certain types of techniques or machines, or you'll have a general idea. So that's why in the notes I kind of keep it really simple with going over the different pieces of technology, and I just try to give you some pictures. So basically one of the things that it talks about is robots. The purpose of the robots is to hold the endoscopes. The endoscopes are the things that are used to placed inside different body parts. So let's say, for instance, a doctor has to use an endoscope to do laser surgery on a person that's having fat removed from the stomach. The purpose of the robot would be for that robot to hold that endoscope there so the doctor can see what it is he needs to do. He's much better able to decide if the tissue is normal, abnormal. You have things called robodocs. Robodocs are used for surgeries involving hip placements. You have the ZEUS, Z-E-U-S, is used for any type of microsurgeries. that may take place. Okay, it's a type of robot. You have the Da Vinci. It's also a type of robot. And again, all of these are in more detail in the book. Plus, there's a lot of different pictures. I tried to put a lot of pictures in here so that you will be able to see. So like in figure 7.3, I put you a picture of images that shows endoscopes where the doctor is using to actually perform this surgery on this patient. I just kind of put you like a little picture up in there so you can just kind of see. 7.4, those are some surgical consoles. You can see like the patient card and then the actual vision card. That's where they can actually look inside of there as they're actually performing surgery and everything. 7.5, I put you a picture in there. 7.6, that's a robotic mitral valve repair that's being done in an operating room. So I put a lot of pictures up in this particular chapter. NeuroArm is also a robot that the one good thing about a NeuroArm is that it can operate even in the midst of an MRI. Okay. Spine Assist, that's usually the robot that's clamped onto a patient's back so the doctor can take pictures when the patient is being involved in spine surgery. Augmentative reality, that's basically where the images are made and they're computer generated, and they call it augmented reality. You have what you call Caveman. Caveman can look at 3,000 body parts. Images can be displayed on the body. It does 4-dimensional pictures. Then you have different type of lasers that are also used in surgery. Okay, so let's get those. Let's talk about those real quick. Laser surgeons. Laser stands for light amplification by the stimulated emission of radiation. Lasers are used in surgery to cut, vaporize tumors, and seal small vessels to prevent blood loss. They also can be used to slow the spread of tumors by closing up lymph vessels, by reducing pain, by closing nerve endings. They've also been used to remove some brain and liver tumors, and laser surgeries or lasers have also been used for a lot of different types of skin surgeries. Lasers can also be used for minimally invasive back surgery. They can be used after strokes to eliminate clots. They can be used to dissolve plaque in arteries. Lasers have been used in gynecology, orthopedics, urology, ear, nose, and throat, and cardiovascular medicine. Okay. Plus, I have that list also in the notes as to where they're actually used. So people do laser surgery all the time. Okay, I have just what I just named. I have them listed here in the slides for you. One of the things that's becoming popular is LASIK. LASIK uses lasers to help correct vision, and what they do is used to change the shape of your cornea. That's basically what it's used for. So LASIK is pretty. It's starting to become pretty popular. A lot of people still would rather just wear their contacts or their glasses or whatever. But there's a lot of individuals that are taking advantage of using LASIK. So computer-assisted surgery holds great promise. It holds really great promise. The use of augmenting images to teach surgeons how to plan and guide operations really helps with surgical techniques, because it helps to cut down on unnecessary cutting. You know, like if a doctor doesn't necessarily have to make a cut, they usually try to do what you call MIS type surgery, minimally invasive surgery. So basically, some of the things that you would pretty much become familiar with when it comes to the MIS surgeries is remembering that hip replacements, gallbladder removals, usually when you can catch these things in their early stages, it's usually better for the minimally invasive surgeries. But you also got to keep in mind the dangers and the disadvantages. You know, a lot of doctors who are more traditionalized are still trained to be those doctors that, I mean, a lot of them don't really rely on all of this technology to kind of perform their surgery techniques. And those are like the more, like I said, the more traditional doctors. They're still with the, you know, the deep cutting and making the lacerations and things of the nature. Where you got more of the current doctors now, they're kind of getting more into the technology pieces. But again, anytime you go and have surgery, you're going to always have those risks. You got your benefits. You always got your advantages and your disadvantages. But one of the things that the book wanted you to see was how, you know, even in the midst of that, even though it is a surgery of some sort, how technology is still advanced in that area. Because like I said, you got the use of robots. You have the use of computer technology where you can actually be performing surgery on a patient and looking through a microscope or at the computer exactly what you're doing, every little thing that's been done. And you know, that comes with having a lot of high-tech pieces of that comes with technology. Okay. All right, so that pretty much kind of wraps up for chapter 7. There wasn't much that I wanted to go over in that, because basically all the book did was just talk about different pieces of technology, give you a few details about it, you know, what it does, and the benefit that it has for the patient. And that's pretty much kind of what I did in the slides. I still encourage you to read the chapter. I do. And I also encourage you to make sure that you actually look at the notes in full if you haven't already done so. Thank you.